Welcome back to another episode of our Healthy Communities podcast. I'm Dr. Phil Wong, Director of Dallas County Health and Human Services, and today we're going to talk about mosquito control, which is one of the most important programs we have in our Environmental Health Division. And joining me today is Scott Sawlis, who is the Program Manager for our Mosquito Control Program. Thanks for being here today, Scott.
Thanks, Dr. Wong. Great to be here.
So tell me, I know you've got a big background in environmental health, some of your path to getting to where you are with our program at DCHHS.
Thanks for asking, Dr. Wong. The path is kind of circuitous to think that many years ago, there was a want ad that said, entomologist wanted, Dallas County, and I applied. And so 30 years later, here I am.
You were an entomologist before.
So went to school.
And you might want to tell everyone what's an entomologist.
So it's not someone who studies words. It's actually someone who studies insects. And so I got my master's degree in that. And so I feel very fortunate that that want ad in the back newspaper said entomologist Dallas County. And I did the interview.
Perfect background, yeah.
Came in here. And so I do the mosquito control entomology side of environmental health. But as you know, our environmental health also includes our animal control services and also our foodborne illnesses with our inspectors. So it's a really dynamic division within Health and Human Services and allows a lot of cross-pollination for an entomologist in the division.
Mm-hmm. Well, glad you're here. A very important role that you play in this. So, tell us a little bit about West Nile virus and the history sort of in Dallas County in particular, too.
What's really neat about it from a scientific standpoint is, you read the textbooks and say, well, how did this emerge? Where did this disease come from? So we've been able to watch this since 1999. So West Nile virus was first isolated in New York City in the fall of 1999. At the time, they thought it was St. Louis encephalitis, which in 1966, we had an outbreak in Dallas County for that mosquito-borne disease. And it was actually the first time we did aerial application. So in 1999, the health department in New York City, they find these birds that are dying and they're thinking, what's going on? And the hospitals are saying, hey, we've got these cases of encephalitis that's taking place. It's got to be St. Louis. Well, all smart people, much smarter than I, they actually identified this new virus to North America. And so we started tracking it. We first identified it in Dallas County in 2002. And now we've got over 2 decades of providing the surveillance and the control measures and reporting the information to our community with the goal of protecting them.
Well, and you mentioned, West Nile virus is one of the most famous out there for our community, but we do have other mosquito-borne diseases also that we are identifying
so there are
testing for.
And so we do look at all mosquito-borne diseases. And the neat thing about our program is we can pivot to whatever the disease is. We have the knowledge to be able to identify the mosquitoes, to trap them, and then to be able to test them if we need to. But what we always like to say is that we keep the main thing, and that main thing is really West Nile virus. And that's because that's what the data shows us, that we've collected these mosquitoes and we found it. And we find it every year throughout Dallas County.
Well, that's what is scary, that just something as simple as a mosquito bite can cause such severe illness. But can you talk a little about all the mosquito control activities that you do with the program?
Sure. So the fancy word that we talk about as entomologists is that it's an integrated control measure. And what that means, as my mentor Jimmy Olson from Texas A&M would say, that mosquito control doesn't begin nor end at like the spray can at the nozzle tip. So it's an evidence-based scientific effort to detect, prevent, and control, in this case, West Nile virus. So that begins with us trapping. We call that surveillance. So we'll trap the mosquitoes throughout Dallas County. We'll identify the species. We'll get those tested for virus. And then if we do find virus in that, we use our communications officer to report that out to the community, and then we'll implement control measures with that. Now, I would also say that in my long answer, critical mass to that is not only what we do for mosquito control for the community, but we really need that buy-in from the community. So one of the jokes I like to say is, it takes a village to raise a mosquito. Well, it takes a village to control a mosquito. There's what we do, but we really need that buy-in. And that's probably one of the greatest successes that we have in our program. It's the citizen buy-in, and it's our other communities buying in with us.
Now, for West Nile virus, talk to us a little bit about the cycle of that particular disease cycle, and because that's sort of important in terms of how we do control this.
Absolutely, Dr. Wong. So to be able to know what the life cycle first of the mosquito is. So mosquitoes, think of it like butterflies. We all know butterflies. You've got the cocoon, and then they open up to this pretty looking thing. Mosquitoes are very similar to that in their life cycle. So it's an egg, a larva, a pupa, and then the adult. So we need to know that cycle first. So the mosquito female, she will bite. And when she bites, which we all know, she'll take blood. She uses the blood to make mosquito eggs. So it's actually the transmission to West Nile virus. We have the mosquito doing their life cycle of adults, eggs, but each time there's a new batch of eggs that hatch, there's a blood meal that's taking place. And unfortunately, sometimes it's us. So with West Nile virus, the virus actually resides in the bird population. So now we take in mosquitoes, birds, humans. This all goes into this cycle of the disease transmission. So it's if I ask you, well, how many bites does it take to transmit disease, Dr. Wong? How many would you say?
I would think possibly one.
So one, and then the second one. So you're
you mean and to get it into the mosquito?
You're exactly right. So the first bite, the mosquito gets infected with the virus. The virus has nothing to do with the mosquito. It circulates in the mosquito, gets back to the salivary gland of the mosquito. Then when she bites, like us, that's where the transmission takes place. So it sounds complicated, but it's really kind of simple. And if we can break that cycle, that's where we can help mitigate or reduce West Nile virus.
But it does, in some ways, it's that mosquito biting the infected bird that gets it into that mosquito. Then it goes into the...
Absolutely. So the source of the virus is in the bird population. So that we really can't control, but what we can control is our behaviors and our control measures to, we like to say, fight the bite and reduce the mosquito bites.
Now, one other question I know that comes up, people ask, how far can these mosquitoes travel when you get this one? There's some that are testing positive.
So when it comes to Dallas County, here's your fun fact. If I was to ask you this, how many mosquito species do you think we have in Dallas County? Give me a number, 5, 10, 50.
Let's see.
Stump the director time.
Well, I know some of it's a few that are in particular for West Nile virus. Yeah.
So we've identified about 50 mosquitoes, but they're pest mosquitoes. We have one species that is our main culprit of a public enemy. And not trying to put you on the spot, but thanks for that. That one mosquito, we say, can fly up to a mile. And that's critical mass because that helps us to implement our control measures based off our surveillance. So 1 mile is about what they'll fly. Now, I would give you like a quick sidebar. We do have that little black and white striped mosquito. We call it the Asian tiger mosquito. Everybody knows what it is because at 5 o'clock on a Saturday in August on the patio, that's what's biting our ankles. That one really doesn't transmit West Nile virus, but that one only flies like your backyard. What we're looking at is the southern house mosquito. That flies about a mile. And that's what we do our control measures and our surveillance based off of that flight pattern.
Now, we've had some really bad seasons with West Nile virus here in Dallas County. Do you remember some of the numbers that we've seen in the past?
Yeah, I do. So as I mentioned, from 1999 to 2002, we were tracking the arrival of the virus. So 2002 was the first year, and that caused all sorts of concern. What are we going to do to combat that? So 2006, was a big year, 2012 and 2020. And so I'll give you some numbers. And so the reason why I say these, we need to look at what my team looks at, which is the mosquitoes and the infection in the mosquitoes. What our epi staff and what you look at as from a clinician is going to be the human cases. And how do we juggle this two sets of data to be able to say, what did the season look like? So what we know is West Nile virus is here. We're going to have it every year. The severity of human caseload or burden or the mosquito burden causing the transmission. So in 2006 and 2012, we had large numbers of cases in our human population. 12 was a bad year. We were almost up to 400 cases. When in the last 10 years, we average about 20 cases in a year. Now, here's an interesting fact for you. What happened in 2020 globally? We had a pandemic thing, right?
Right.
While that was taking place and your staff was, here's where public health and the operability of departments and the success of your program, while you were combating COVID, we were still doing West Nile virus. And in 2020, believe it or not, was one of the highest incidents of our infected mosquitoes on record. But nobody really knew, but we were still doing our job while we were still responding to a pandemic. So it's definitely cyclical. So 2006, 2012 was really a bad year for us. Thankfully, in 2020, we were able to reduce the mosquito population and we didn't have that spillover.
Yeah, and the human case numbers weren't certainly not as bad as 2012.
No, absolutely not. And I'd like to say it's because of the program that we've really fortified with not only here at Dallas County, but our partnering cities to help do the surveillance and control measures. And
again, the human toll can be very serious illness. Although I know we say about 20%, of persons who are infected then actually might have symptoms, and then only less than 1% have severe life-threatening symptoms even. But it's definitely out there. So sometimes the numbers even of human cases are sort of just as small, the tip of the iceberg in terms of the numbers that are actually having transmission.
Absolutely, yeah. Right.
So describe what the routine day-to-day activities of your staff are with mosquito control.
Sure. So what I like to use this phrase that we trap, we test, we tell, we treat, we repeat. So what that means is from really Sunday through Friday, we deploy traps throughout Dallas County, and our partnering cities, they also deploy traps. We set a trap in a yard. That trap gets collected and brought to our field office where we identify the mosquitoes. Once we find that particular species that we want, we put a subsample of that, and then we bring it to our laboratory here where we do the virus testing for that. And what's really exciting about that is we've been doing this procedure for 20 years. And I would say we are a center of excellence when it comes to this because we get rapid response and rapid turnaround. So if we'll set a trap on let's say a Monday, we'll identify the mosquitoes Tuesday afternoon, we'll get those tests brought to our laboratory. They can run those samples and have them to us the next morning on Wednesday, and we can commence control measures. We can provide public information to the community of what's going on. So it's real-time response to a vector, in this case, a virus that we're fighting.
Yeah, no, definitely you and your team are a center of excellence and doing really stellar work that is recognized. So let's see, what do those traps look like, actually?
So I don't have them with me, but I can describe it. It's a 4-inch PVC pipe, about yay tall. It's battery operated, and we have a fan inside of it. And as I mentioned, the mosquitoes, part of their life is in near water, and the part is flying. So when the female is ready to lay her eggs, we fool her. And we put out a bus tub. It's literally like when you go to the restaurant, the bus tub. And we fill that with what we call stinky water. And so the mosquito, she thinks it's a great place to lay her eggs, and she gets sucked through the pipe. And on the top of the pipe, we put a net. And all we do is we extract the net. We take that to our field office. We identify them. And then the whole procedure continues the next day. So it's a battery operated fan is really what it is.
Mm-hmm. And again, as you said, we then, when get positive results and things, then get the message out. Any thoughts or anything you want to share about how we get those messages out, or what sort of messages we put out there?
So I would say, again, to steal an old line and adapt it to mosquito control, don't ask what mosquito control can do for you, but ask what you can do for mosquito control. And so we really need and strive and ask that we get public buy-in. And so our messaging has been, well, what's one way you can do it? Well, we use the phrase fight the bite. Well, what does that mean at a strategic level? So 4 Ds is our message. And so the 4 Ds stands for DEET, which is the repellent. It's the active ingredient in the repellent. Dress, and unlike us, we like to wear light colored clothes because they're less attractive to mosquitoes. So DEET, dress. This is the buy-in, right? It's the drain standing water around your house. And when you're outside, avoid activities during dawn and dusk. So DEET, dress, drain, dusk, and dawn. If our community will continue to buy in that, we can really reduce the bites.
Mm-hmm. And I know we do get that word out there during the mosquito seasons, definitely. Now, it does take a lot of coordination with the municipalities within Dallas County. Can you talk a little bit about how we work with them?
Yeah, so I would say we work with them very well over the decades of partnership. And this really comes back to our partnership historically within environmental health. And so with mosquito control just being one facet of environmental health, we are able to communicate with all 25 municipalities to do the surveillance. And surveillance is a fancy word just for mosquito trapping. We want to know how many mosquitoes are out there, what kind, and if they carry disease. And so our program works with all 25 municipalities. We'll deploy, like in a typical July time, maybe 200 traps throughout the week in that all of Dallas County areas. So we communicate directly with our point of contacts for each city is one way we communicate. And then they communicate back with us. And then we see them face to face during the week when they bring the traps to us. And then of course, one of the main focuses that we do is through communications and from our communications officer, getting that information out to the community. So one, they're aware that, hey, it's West Nile virus season. And 2, here's where we have identified a localized infection.
And are you doing this all year round?
So our program is an all year round program. I was just talking with our team today and I said, you see what the weather's going to be like next week? Warm, 80s are already early in our season. So the West Nile virus season is April through November. But as Dr. Olson would always tell me, Scott, mosquitoes don't read the same textbooks that we do. Forget about the calendar year. So we always provide that service because we need to be able to adjust based off of the seasonality of the mosquitoes.
Yeah, and I mean, that's great service because I know a lot of the other programs in the state doesn't actually do it all year round. I think they have some periods where they're not collecting specimens. So that's a better service as many places, again, is sort of exemplary. So now you talked about the weather. Tell us a little bit about the relationship between the weather and the mosquito activity.
So contrary to what folks think, right? So if I asked you, hey, Dr. Wong, does rain make mosquitoes? You'd say, well, yeah. When it comes to our West Nile virus mosquito, it's actually drought produces favorable condition for that mosquito. Remember I said that we put our traps out with the stinky water? So during drought conditions, the water that we have in the yards, mostly sewers and storm drains, begins to dry up and it becomes highly polluted. That's the ideal condition for that mosquito. Rains actually help us. It actually flushes those things. So what we do know, because we've got robust set of data, we will have mosquitoes, we will have West Nile virus, and it's part of just our normal summertime activity. But if we can collaborate with what we do and what the citizens can do, we can reduce the burden.
Now, how about the temperature, the winter and the cold,
right,
and the impact
right.
on them?
So Cook County is Chicago. They have always had St. Louis encephalitis, and now they have West Nile virus. You ever been to the upper Midwest in the winter?
I have. I used to live there.
How cold is it in January?
It's freezing, yeah.
And in the summer, they still have West Nile virus. So I wish that cold weather impacted our mosquito activity, but it really doesn't. So that's why we stick to this year-round surveillance, so we can adjust to it.
All right. So any predictions on what we can expect for this coming mosquito season?
Well, if I had my magic 8-ball, that usually gives me the best answer. So what we do know is West Nile virus is endemic. And thanks to your leadership, the leadership from Commissioner's Court to help supporting us, from Assistant Director Phillips, we have the infrastructure to be able to do the surveillance, identify, detect, and control West Nile virus should we have a large burden, a medium burden, or a small burden. So we will have West Nile virus.
Mm-hmm. And so what happens when someone tests positive for West Nile virus here?
So with West Nile virus, when it comes to the human side of things, that's where we rely as mosquito control heavily on the clinical side.
Physicians, area physicians need to be astute, and that's why we put out that word to physicians to be thinking about it also. And
right, so that's where where your leadership through EPI to get that out to the medical society and the medical community to say, hey, be advised, our mosquito control has identified.
Because there's not really a treatment.
Right, so it's a virus.
Yeah,
so
exactly. So
what I always say, it's an encephalitis, so it's a brain swelling. Can you help an old mosquito man understand what that means?
Well, again, it's not a treatment, but it's that supportive care, and it's that less than 1% that have this severe complication that could be severe neurologic impact and even death. So that's why it's really important to prevent those mosquito bites in the first place.
Absolutely.
So how can someone contact the Environmental Health Division and learn about the work you've described and other things that are going on in that program?
So an easy way to do it is a phone number. So you can call our office, 214-819-2115 or 214-819-2112.
Thank you, Scott, for educating everyone about the important work that you do with our mosquito control program. And please join us for our next Healthy Communities podcast, and be sure and like and subscribe to our Healthy Communities channel. We'll see you next time.